Goodbye, Bree.
All right, it's 9 a.m. I want to thank everyone for coming this morning. Good morning, everybody. We're going to call the meeting to order right now. If you have your cell phones on, please mute them, and we'll do roll call. Becky?
Sure, absolutely. Reed Acree,
Here.
Tom Kitson,
Present.
Mike Book.
Yeah.
Jason Anderson, Tom Wilson, Ally Hess.
Here.
Does anybody have anything to say before we get started here? Any reason to delay this any? Well, we're going to be going through the services, meeting with everybody or representatives from each of the organizations and hear what they have to say and kind of roll through this as quickly and painlessly as we can. So appreciate everybody coming out today. So do we have Susie here? Susie Welch from Lee County Council on Aging? No? Okay. How about Mike Hughes from Lifescapes? Come on up, Mike, if you would, please. And if you'd now, you're the executive director at both Lifescapes and Meals on Wheels, correct?
So, thank you. I just realized today, this is my 13th year speaking in front of. That's better?
Yeah.
I'm not used to technology. I'm very sorry. I'm a Luddite. So it's my 13th year actually coming to Lee County, so we appreciate it. In years past, we have asked for funding for 2 of our programs. One was obviously Meals on Wheels, which we do in Lee County. And the other one was for Adult Protective Services that we do in Lee County as well. This year, we've asked to put that funding directly into Meals on Wheels instead of Adult Protective Services. And the reason for that is, as everybody knows, we go to the grocery store, our food costs, and I just calculated this 2 weeks ago, our food costs since 2020 are up 32%. Our food costs are. So things that cost us $1 now cost us, $1.32. And our food costs are such that some Meals on Wheels providers in the state are making decisions about, do we serve everybody? Do we not serve everybody? Do we have wait lists? We do those. And I work really hard so we don't have a wait list. I've been executive director now for a little over 10 years. And I've never had a wait list as I've been executive director because people need our service. They need our service. And how Meals on Wheels works is you just get a grant. It's just one grant. And it's not, the more you serve, you don't get more money, the more, whatever you do, your truck breaks down. We have trucks that we have to service. We have all those types of things. Too bad you have this grant, so you have to raise the rest of the money and do the rest of it by yourself. So those costs are exponentially growing every year. Also, we have to match 15% of all of our money locally. So that's a federal requirement. So every dollar we get, we have to find 15 cents. For a match for that. So that's becoming much more difficult as well. There used to be companies that would do things or, a lot of things aren't local anymore. And so, different fundraisers that we do and different ways to it. So the counties that we receive funding from, it's very important for us that we have that local match to meet that. We believe that we're good stewards of the taxpayers' dollars. We believe that we take care of the clients that we're charged with taking care of. And we also believe in efficiencies. We believe in doing things. We have an inventory management system. We have robust accounting systems that track real-time data to make sure that we're doing things efficiently. So we appreciate the taxpayers of Lee County and what they've done for us in the past, and we'd appreciate funding going forward in the future. So I'm open to any questions you may have.
I have
Yeah.
one.
Yes,
Mike.
please.
First of all, thank you for the services that you provide. I'm aware of several people that I know that take advantage of your services. So there are Lifescapes and OSF Meals on Wheels.
Correct.
Are they completely 2 separate organizations? Is there any collaboration that occurs
Well,
between the 2?
I'll collaborate with anybody, right? So we have services in 11 different counties in Northern Illinois, right? So my job doesn't work without collaboration. So yes, we do collaborations. Here's the fundamental difference. For Lifescape, we are what's called the Title III Older Americans Act designated. Home delivered meals is the technical definition of it. Home delivered meals. It comes from the Association for Community Living and the federal government and the Illinois Department on Aging, right? So we have to compete for our grants every 3 years. We have to write our grants, compete for them every time. The Dixon that happens at the hospital is just a volunteer run organization that kind of does Dixon, right? I don't know if they charge for the things. We don't charge for our service. We have to allow our clients to donate. That's part of the law. You have to anonymously donate, right?
That's the rules of the grant.
The rules of the grant. So we send them a letter every month and say, hey, if you'd like to donate, we'd help. But if they don't, we don't deny service if people who can't pay.
What's the size of the grant?
So it depends on the county. So it's real convoluted. We do Meals on Wheels in 5 counties. It depends on the county. So there's an equation, like how many people over the age of 60 you might serve. So they do it based on, you can get into the weeds on this, but based on a AAA area. So we're in NIA, in Northwestern Illinois, Area Age 10 Aging, and there's 9 counties in NIA. So Illinois gets X amount of funding from the federal government based on the amount of people that are 60 and over compared to the rest of the states. And then each county gets the same part of that money based on how many people are 60 or over base compared to the rest of the state. And they divvy it up that way. So all told in our 5 counties, we have about $4 million in federal and state money.
In Lee County, how many meals are you serving?
So I have that in my, so it's about 24,000. I'm going to get this right. So last fiscal year, so I did the last fiscal year, which ended October 1. That seems like a clean way to do it. So one full year, we did 24,255 meals for 230 clients. That's what we did in Lee County.
And you have people that deliver the meals and they're employees, they are paid.
Correct.
As versus OSF, they have volunteers.
We do have some volunteers. We do have volunteer routes in all of our counties. We have people that volunteer. What we have found, because we'll do 600,000 Meals on Wheels deliveries this year. So that's what we'll do in all of our counties. But we have found that it's hard to plan if we rely only on volunteers. That if we have a route and then our volunteer doesn't show up, how do we account for that? So we do have volunteer routes. We have volunteers in every county that deliver meals, but we do have paid staffers.
Mike, what's the trend been probably the last 5 years? Is it growing or?
Absolutely growing. Absolutely growing. I always say this to people that the demographic trends of people, the aging population growing didn't sneak up on anybody except for policymakers. It's the only people that are surprised, but there's more people that are older now. What ends up happening is obviously the baby boomers are now, in the senior population. But because of modern technology and different breakthroughs, people tend to be more living longer, but then they're also more active when they're younger. So we don't have a lot of, 60-year-olds on there. What happens is a lot of 60-year-olds are working. I'm 53. I'm not that far from 60. So they're working so what we find is when they get to us for any of our services, and we have a myriad of services, when they get to us, they tend to be older, sicker, frailer, poorer by the time they get to our. So that's the trend, is we get people that it's time for them to be in a more of a desperate type of position. Mm-hmm. So those are the trends that we're seeing. And we have been seeing those for quite some time go to that direction.
Like how does someone qualify for Meals on Wheels?
So it's actually relatively simple. So you have to be 60. That's and again, I'm 53, so I didn't make that mean a senior citizen. The federal government did in 1965 when they passed the law. So you have to be 60. And then there has to be some impediment to you feeding yourself. That could be economic, that could be physical, that could be, so we go through a whole checklist of things why is it that you can't feed yourself? So that's why we deliver it. And one of the things that we do when we get a client is many times we're the only person that client will see during the course of the day, is our driver And all of our drivers are trained to recognize different things, you know, they're trained to recognize there's something going on here, we need to call. So we have a dispatch center where we have our Meals on Wheels caseworkers who, if there's something wrong, they don't answer the door. We go through a checklist of calling next of kin, calling caregivers, and then it happens more often than you would want it to happen. One of the last calls we make is to the sheriff's department to do a wellness check, because if we can't get a hold of that, we have to see that client every day. If we don't, then we're going to make sure that everything wrong, okay with them. But so it's 60 and then some impediment to feeding yourself.
Like, I appreciate what you're asking for and how it's going to work, but how does that impact your adult protective services by us not funding that?
It's a really good question. I think our adult the decision we made internally is our adult protective services, it doesn't have a matching portion to it. So the reason we always asked for money for adult protective services is we don't get paid unless we have a case, but we still have to employ the investigators and caseworkers and those types of things. So that money that we would get from other sources, fundraising, or from counties would help pay people until we institute an investigation, get paid from the state of Illinois. So we made the decision that it's more important for us as operationally, because again, costs are going crazy right now, that for us to have that was kind of the thought process on that.
And what are adult protective services? What is that?
So adult protective services used to be called elder abuse. So people, now they added under 60 adult disabled into that, which is a small, maybe 4% of what we do. And we do adult protective services in 5 counties as well. So if somebody believes they're being abused, if somebody believes their neighbor is being, they can make a report and we can go and investigate and do case management and work with law enforcement and try to get them out of that abusive relationship.
So you guys, gentlemen, have any questions?
What you do.
Thank you
Yeah,
very
yeah.
much. Well, we appreciate you. We appreciate, again, we understand that it's taxpayers' money and we take that very seriously.
All right, well, thank you very much, Mike.
Thank you. Appreciate it.
Just so you know, the process kind of, we'll see where we're at and you'll be notified here at the end of the process, I
Becky
guess.
does a real good job. She's very professional.
She does an awesome job.
She did a real good job.
You two probably know way better than I do as far as the process goes.
Thank you so much.
All right, thanks, Mike. We're gonna, one of the things you need you to remind me, Becky, is I failed to just check about the minutes. So before we leave, let's do the minute, okay, thank you. Next one would be Julie Shupner from Catholic Charities. They're transitioning to CGH. Oh, and I we
Good
can
morning.
talk about
Good to see
that.
familiar faces. This is Kat Pence. She
Good morning.
is my
Morning.
newest community ombudsman with our team, and she's actually working for us in Lee County. So I wanted her to be present today and to see everyone and for you to see her because she's in your county working. So thanks for allowing us to come in and talk today. So as I see familiar faces, I know I'm sure you're aware of what our program is and that we're.
Well, I'm fairly new, so
Excellent. Well, then I get to
I
tell
wasn't
you.
here last year when you did this.
Right. So we're the sole designated advocates for adults that are living in long-term care. So that's anyone over the age of 18. And they can be there short-term for maybe a therapeutic rehab stay, or it could be their home. And that includes nursing homes, assisted living, sheltered care, supportive living, and then the intermediate care facilities for the developmentally disabled. We also, as a program, cover VA homes and what they call, the acronym is SMRFs, which is the Specialized Mental Health Facilities. However, in our 9-county area that we cover, those 2 licensures we don't have, but our program does cover those. So we're a federal program through the Department on Aging that every county and every state's required to offer the services for. So one of the easier ways to show it, because you knew I get to share, here's the map for Illinois. So we cover Area 1,
Mhm.
but other service providers cover the other counties throughout the state as they do other states. So there's two real distinct pieces with our program, and that's one, and it's written in the Federal Act, is that one, everything we do is directed by the resident themselves. And if they cannot give us direction, then we look to their legal representative or their appointed representative, which could be a family member, agent under power of attorney, or even a guardian. And the other piece is that every conversation we have with anyone is confidential, and we cannot share it unless they give us permission to share the information. So the resident themselves, they drive the work that we do because they live in the long-term care home. We want to make sure that they're very familiar and comfortable with what we're doing. So we give a lot of education, work to empower residents to know what their rights are and to assist them in ways such as discharge planning. So it's really key because most individuals tell us that they do not want to be in long-term care. I don't think I've met one yet that says, I can't wait to move into a nursing home. So whenever we see them and we're talking to them and introducing ourselves with these routine visits, which Kat will talk about here in a minute, one of the things we're doing is asking them what their goals are. And most of the time, I want to go home, or I want to get back into the community, or I want to go back to church. So we work on that. That's what we do. We really focus on getting them the highest level of independence possible, where they're at, working on their goals, making sure that facility staff are doing their work as far as working towards those goals, whether it's setting up therapeutic services, if they want to reintegrate into the community, making sure the assessments are done. What does that look like? What do they need to be supported in the community to live safely and thrive? And sometimes it's connecting them to Lifescape, Meals on Wheels. You know, other times it's kind of making sure that they have caregiver services that can come into the home and getting the assessments done for that. So there's a lot that encompasses the work that we do. Kat's going to speak briefly about what she's experienced since she's been with the program. But the one thing I did want to mention, which is kind of interesting, and I think it really relates to having your community programs come, is that I've been with the program for over 11 years. Kat's one of the first people that I met when she was working at Adult Protective Services. So we circle around. She understood the program. We interacted on different levels. And then we didn't talk for a while. And then when we were looking to hire, Kat knew the program. We knew each other and she applied. And I just think that speaks volumes for how we all work together. And whether it's Lifescapes or, you know, Adult Protective Services, Prairie State Legal Services, there's all these different services. But we're all kind of a family working together for the older adults that live in our communities. So you just.
Sure, absolutely. You know, I'm newer to the program, but I have been working with seniors for many, many, many years. I'm very happy to say that the majority of the folks that I speak to in Lee County are very happy with the services they get. But again, as Julie said, most of them don't want to live there. They would like to go home. And so part of my role is to make sure that each facility is providing those services, those care plan meetings, making sure that we are working in tandem with the outside resources plus facility resources to make sure that people are going home safely. I have in another county a situation where a lady ended up in long-term care and she doesn't belong there. She really needs to go home. And we're working very hard with the facility to get her back home. You know, there are some things that we need to work through, but that's part of our advocacy, is providing that sort of bridge between inside the facility and outside the facility. Right now, I have 2 or 3, I think, cases that I'm working with APS in the community, because we have several times we have folks that are living in long-term care and they're either being financially exploited or there's some neglect or, you know, something is happening. And so it covers both of us kind of. So that's you know, one way that we're working with other agencies in the community. So, but again, you know, I'm really happy to say that the services and the facilities here in Lee County do a really good job, and I don't get a lot of complaints, and that makes me really happy. But I do go to resident council meetings. I can kind of get a feel for how things are going, if, you know, the mood in the building, how people are doing. And that really gets my face in front of people too, is the resident council meetings. And I like to show up during meals and kind of work my way through so everybody knows who I am. But really, that's what we do. We're the face of the people who are advocates. A lot of times people think that we work for the facilities, and we absolutely do not. We are resident driven. And I think that that gives people a peace of mind, knowing that we're not affiliated with any one group or organization. We are simply resident driven.
So I have a question. How does someone know about your services and solicit them?
It's a great question.
That is a great question.
Sometimes I feel like we're like the best kept secret. We've been around for a long time. But in the federal law in the 60s, in 1989, the grant was written for us to be inside the facilities. So we're around. There's posters in the buildings. We regularly do routine visits, and that's where
Routine visits?
inside the
of
long-term care
long-term
home. So
care.
we're in, and it's 24/7 access that we have. We do not announce our visits. They don't know we're coming in unless we have a scheduled meeting. And we come in and hand out brochures like what I showed you, our business cards. Our brochures are the same visual as the posters that they're required to hang up in their buildings. So we try to make that connection too, so that they know how to reach out to us. Kat had mentioned resident council meetings. Those are meetings that are held internally in the long-term care homes that are ran by the residents for the residents, where they can air concerns, get information. If they're having trouble with food or laundry, just all of our daily lives inside their community. So we present there often, but we have to be invited as a guest like anyone else. But we talk and let them know who we are. As Kat said, it's a way for her to get her face out there so that they know. They may not be able to pronounce ombudsman, because a lot of people can't, takes you a while, but when they see Kat, they'll know, or they might remember the word advocate. So it's getting our faces out there. The other thing is that we do as many health fairs and community educations that we can, just to get our program information out, hopefully to those that need it, or get it to them before they need it, so that when they do need it, or they think they might need it, something will trigger and say, hey, we talked to somebody. There's an advocate in there for us. Or they can tell someone that they're sitting next to in church. You know, my mom's in a nursing home. We're having a hard time. Hey, I met somebody. So a lot of it is that promotion through community events such as health fairs.
I'm looking at the statement of activities from July 1st of 25 to
Mhm.
January 31st of 26, and I see the total revenues. The highest operating, you have salaries of 155,790, and then there's administration, 40,000. Can you explain kind of what the difference there, or what that
Let me
is?
look and see what you're talking.
So it's broken down in revenues, expenses, and then operating expenses.
Right, so which line were you looking under?
Well,
which
under
line?
administration, it says 40,000, and then you got salaries at 150,000. This is for 6 months, right?
71 to 11, yeah. Administration, I guess I'm not. Oh, administration, the 40,000. You know what? I can double check on that. However, the way that, so for the salaries, the 155 is a snapshot for our program. We work on different grants, so that all comes together where we get funding for part of that. Administration, I'm going to check on it to make sure, because I don't want to give you the wrong information.
Okay, well, it's your largest expense.
Right.
and it-
What I am thinking is that it has to do with part of the rent for our building, for our office in Rockford, but I'm not positive.
So this budget, actually, this
Mhm.
activity pertains to the entire Zone 1, not just Lee County.
Correct.
Okay.
Because all of our staff, we have staff and volunteers both. And there's a very extensive certification process. It takes a long time to get someone certified to do the work for our program. It's, Kat can contest to that. It's over 2 months to get certified full-time. Then there's continuing education of 18 hours a year that they have to do. It's a requirement. So when all our staff get certified, they're certified to to work in any of our 9 counties.
Mhm.
And everyone has kind of a special niche. Everyone's got a background where they specialize. We have ombudsmen that specialize in like severe mental illness and working with the developmentally
How many people
disabled.
do you employ?
We have 8 in our office, including
In your
myself.
office is where?
It's in Rockford.
It's in Rock.
Mhm.
Okay.
So my point being is Kat may go and work in Whiteside County to help the ombudsman there for a situation. The same as our other staff have come into Lee County. So that's why our services cover everyone and everyone can work within the 9-county area.
How many nursing homes in Lee County do you cover?
We have a total of 3 nursing homes in Lee County, 2 assisted living, and the rest are the intermediate care facilities for the developmentally disabled.
Mhm.
And I did make a little note on my application. I don't know if you saw that. But the last couple of years, you've had a few homes that have either lost their licensure, converted to ASILA. Some of the intermediate care facilities for the developmentally disabled, they have put it out there that they're trying to transition their licensure into ASILA license, which we are not covered.
Mhm.
We don't have that authority in SILA as it goes through Office of the Inspector General and differences with the licensure.
So what percentage of your overall operating budget is covered by grants, by the federal and state government?
Well, the majority of our program is covered by state grants that we receive in funding. Federal is the smaller pocket of money, but the majority of it is state. So we have some donations that come independently into our program. Yeah.
And in regards to all the counties that are in this zone, zone 1,
Mhm.
is the request the same for each county, or is it different based on population or based on something else?
Well, it is a good question. Funding requests have changed, especially over the last 5 years. So we don't have a formula necessarily that we use to request funds. However, we look at the county, see the needs that we have, such as mileage. So a lot of times, funds that we get from tax levies helps us increase our presence in Lee County. I think it's Mike that said in the past, if he doesn't get the funding, he still provides the service because we have that requirement. We do too as a federal program. So we're going to provide our service no matter what. But the support that we get from the tax levy funds and United Way funds, that allows our staff to be in the counties more. It helps pay for the mileage and the time and maintain our agency cars.
I'm not sure if I totally understand the tax levy part, but this request that you asked
Senior funds.
is above and beyond the tax levy.
Correct.
Right.
I understand.
Oh,
Mhm.
that's the question,
Yeah,
not a
yeah.
statement.
So, and the short answer is it allows us to be more present in the county.
Uh-huh.
Yeah, because gas, everybody knows gas is very expensive, the time that we pay, because we've increased salaries as we've had to stay competitive.
And have you raised the levy?
I'm not sure. I understand. Right, right.
But have we raised the levy?
Well, we changed how we levy for it a few years ago. So historically, and a lot of counties, we'll see a specific levy for social service.
Mhm.
We no longer break it out in that way, but what we do is set aside general fund money, for social services. So
Above and beyond what this is, this request.
no, that's our levy.
Well, that is our levy.
That is our.
Okay, all right. That was what I was trying to understand.
We levy, we distribute it how we see fit. They're
Okay.
making-
Okay, that answers the question. Thank you.
Well, I want to say that, it's great that Catholic Charities is there as advocates for, because there's so many people that either don't have family nearby to help them, or maybe the family just isn't equipped to be able to help them as much as for the transitioning and representing them to get them out back in closer
Right.
to home or whatever's best for them.
Well, and that's absolutely correct. Family usually has the best of intentions and they want to be there, but not everyone's comfortable even going into long-term care. And there's a big suitcase you can unpack with that between, guilt and family dynamics are always fun. But coming in as their independent advocate, we don't have the ties. So we really we don't go in as best interest because that's not our role. Our role is to amplify the residents' voice, to make sure that they're being heard and recognized and that everyone's working towards their goals. That's really our role. And it's not the same role as maybe a daughter that's, having to go see her mom in long-term care and not liking that. And, so the work we do is important. We've done it for a long time. Catholic Charities has actually had Area 1 since the onset of the grant in 1989. So I'm only the second regional ombudsman and program director since 1989. So prior to that, it was Kathy Waitman Moore. And she didn't leave necessarily. She went up to be the diocesan director of social services. So she still oversees our program and is a great benefit for us to have just with her knowledge. So thank you. I appreciate that very much, saying that.
Do you gentlemen have any questions or?
Thank you.
Okay.
Oh, Ally, do you have any questions?
Okay, thank you.
Thank
Thank
you
you.
very much. We appreciate it.
Appreciate your time.
Thank you. And
you.
I will email back with the administration question
Sure.
with more detail
I
for you.
appreciate it. Thank you.
Okay, thank you. Can I send it
Jay-
to Becky's
Yeah.
email?
Becky,
Is that okay?
that's great.
Okay,
Perfect.
thank you very much,
Thank
guys.
you. Next on the agenda would be OSF Meals on Wheels. Linda? Hi, Linda.
Morning.
Have a seat. How are you today?
Very good.
Good.
Glad to be here.
Tell us a little bit about OSF Meals on Wheels and then kind of what you're looking for here.
Okay, so the Meals on Wheels program is operated only in Dixon. It's managed all by volunteers, and I'm on the board. And I retired from what was KSB, and now I'm just on the board. And so,
Yeah.
just, yeah. And so, anyway, we have volunteers that will deliver the meals to the participant, and we pay OSF to make the meals, same as it was with KSB, and they're charging the same price. So we pay $3, no, we pay $4 a meal for I think it's four, it could be $4.50, but I'm thinking four. And then the participant pays $3.50. And so, the numbers that we serve right around 40 people. Probably 10 years ago, we were up at that 60, 70 range. And the last couple of years I was there, with so many had passed away. And, as they pass away, we look to try to, recruit more people to be on the program. And maybe I should say, thankfully, we are still sitting at about 40 people. So the routes are split up into 7 routes. And so the participants or the volunteers come and they take and they deliver. We do the same thing that the other Meals on Wheels program. We knock on the door, we hand deliver the meal, we'll visit with them, we check and make sure they're okay. If nobody answers, we call their person, their caregiver. And then if we can't get a hold of them, we call the Dixon Police. We have saved a couple lives, and we have over the years found a couple that have passed away. Found a lady that fell down and broke a hip, and found somebody that fell outside. So it's a good program. We're there every day about 11:30, or we start delivering at 11:15. So around 11:30, we're to most of the homes. I personally have been delivering to the participants too, and it's a great interaction. It really is. And some of them are just, hungry for that personal connection, and they want to hug. You have to hug them, or you have to come in the kitchen, and you have to see how they're going to set their food up. And, but it's just nice to be a part of that kind of program.
And your request has been the same looks like for several
Yeah,
years.
yeah. Yeah. We're grateful for
Sure.
whatever we can get.
Yep, so. I don't know, Jason, do you have any questions?
Do you have any, what's your major source of revenue? What is the lar-
Donations.
Donations.
Yeah.
It's just simply charity
Yeah,
donations.
yeah,
That's how
donations,
it's
yeah.
funded.
We have received somebody passes and I can't think what it
Yeah,
is,
a
but they get.
memoriam.
Yeah, and
memorial
so,
money.
so we'll get money that way. I think it was last month, we got $2,000 from the Lighting Center. Just, 2 years ago, I went and spoke to them, and then they were gracious enough to give us $1,000 that time. And they showed up 2 months ago just at our office at I keep calling it KSB, but at OSF, and they said, here's donation for you this year. And we're like, this is awesome,
It helps.
and it's so appreciated. One of the things that we do is that we do special things for the meals participants, and we don't charge them. Like we might do a 4th of July meal, and then we don't charge them for that meal, and it's paid for from the funds that we have received through the year. So we don't charge them for everything.
Do you solicit support from local church? I see there's a number of churches, but not many.
Yeah,
but-
we have 10 different churches that are involved. I think it's 10. 10 is the number of board members. And then we put notices up at the churches, and we have the board member talk to any kind of parishioners if they need help with
Mhm.
anything. And we go through the doctor offices, we go through the discharge nurses planning, so that if somebody's being discharged from the hospital and they need meals for a short term, they can get a meal. The thing we do with our Meals on Wheels is it's not age related. It could be a 20-year-old that is home with something had happened, a broken leg or whatever. Nobody's there to feed them, and we can get the meal to them for lunchtime, and they can get a sack supper if they need to. And they need to be on it for 2 weeks, fine. They can be on it 2 weeks and drop off. So we have a lot of people that will come on and be on for a short term, and then they'll go back off when they're better again. So anyone qualifies for it. We do only deliver to the city of Dixon. Well, we say it's 3 miles from the radius of the hospital. So it pretty much covers the whole city of Dixon, a little bit of outlying areas.
So you're OSF, but the hospital itself is where the food is prepared, but
Yeah.
it doesn't,
It's
OSF
not-
doesn't.
It's Meals on Wheels of Dixon is
Oh, Okay,
incorporated,
that's.
is our name.
Yep.
OSF is just the provider of the meals.
Okay.
Thank you.
And we pay OSF for that, but it is Meals on Wheels of Dixon.
Does the cost that people pay cover the cost of the meal?
No, we pay an extra 50 cents. It's either $1 or 50 cents more.
Well, I personally have been in contact with your office. I have a friend that was all alone, had no family, and he was in the hospital. He's home now. You're now providing. I've seen personally what you're doing, and personally, I wish the county had a lot more money to help you out, but we are pretty limited too, like
Well,
everybody else. But
And we understand that. And so that's why, we go to other sources, the churches, we get donations from churches every quarter, it feels like. And then, we just randomly got that donation from a will. And I mean, it's wonderful to be thought of, and it's nice to know that we're making an impact for our community.
well, you are.
Yeah,
Absolutely.
and thank you for.
I wish the food was as good as it was when I was there.
Well, question, and I asked this of Mike also, is there any collaboration between Lifescapes, Meals on Wheels and OSF?
We
Meals on
do,
Wheels?
yeah, I don't know that he said it, but we do. If we can't deliver to somebody in the city of Dixon, we always refer them to Lifescapes.
Okay.
If somebody we got a phone call from Papa, and we don't deliver there,
Oh,
it's too
yeah,
far,
Right.
so we send them to Lifescapes. So we make a lot of references to Lifescapes for that.
And where's the Lifescapes meal come from?
The last I knew, it's prepared in Rockford, and then it's shipped down to Oregon, and then it's split up, and then it's shipped out.
Okay.
Am I right?
5 days a week, right?
5 days a week. And if we do any holidays too, if they fall during the week, we deliver Monday through Friday. So if Christmas falls on a Wednesday, we're going to deliver to them.
Oh, nice.
And when I was there, we used to send them a Christmas gift too,
Mhm.
you know, just a little extra touch.
Yeah.
Well,
Who delivers the meals to senior centers? That's still Lifescapes, Mike, or? At senior, okay.
then are the volunteers using their own vehicles? or-
Yes. Mhm.
Wow.
Yep.
Seem to love it. So good. Look forward to it.
We had a volunteer luncheon. Well, I guess it would have been about a little over a year ago. And we were thinking we'd probably have 40 or 50 people, and we had almost 150 people come for our volunteer lunch. This is anybody that's ever volunteered and delivered meals for us. It was amazing. Anyway, it was we had a good time, and we very much appreciated the volunteers.
Well, I know that this friend of mine who's getting Meals on Wheels now, was in a nursing home for 6 weeks. And he is really loving the Meals on Wheels.
Awesome. Awesome.
The meals at the nursing home were pretty bad. And he's very, very appreciative of it. So good work.
That's fantastic.
Thank you. We're
Thank you. I'll
blessed-
pass that
We're blessed
on.
to have it. We're blessed to have you.
Well, anything else you have to
No,
say? or
I
ask,
appreciate
or-
being called and having the opportunity to talk for our Meals on Wheels
I
program.
appreciate you coming out here today. Thank you.
Thank
Thank you.
And just so everybody knows, from the board here, all these requests are in the resource packet or portion of the onboard.
Can I make one comment? I know Jason was asking some questions for Catholic Charities. One statement that I would like to point you to when you're kind of looking, especially at a nonprofit, is the statement of functional expenses that they provided. That is kind of the statement that everybody looks at when you're looking at a nonprofit. It's showing you how they are expending their expenses for the programs that they're providing. And a good thing to look at is the ratio of their general expenses to their total expenses on all the programs and whatnot. So they did provide that. It's their annual financial statement, so it's only through June 30th of 2025. I'm sure they're in the process of getting this year's audit done, but that is the kind of the most important statement when looking at a nonprofit.
Thank you, Reed.
All right, moving on, is there anybody see anybody from the city of Amboy here? Seeing none, their request is in the packet as well. Dixon Public Library, is Kathleen Schaefer available? Oh,
I'm here. I don't know where you see me, but
oh yeah, thank you, Kathleen.
can you hear me okay?
Yeah, we can hear you fine.
Okay, great.
Tell us a little bit about what's going on with the Dixon Public Library and what
Well, There's a lot going on at the Dixon Public Library, but specifically why I had submitted the request to you folks was to help supplement our budget for large print material. Obviously, we don't check the age of the folks when they're checking out books to find out who is reading the large print materials, but you can anecdotally imagine that it's primarily a senior citizen population. They're a very dedicated group. Whenever they think we're weeding out part of the large print collection, they ask us about it and think we might be getting rid of something that they want to read. And, you know, as I've been sitting and listening to the other folks that have been speaking, this might seem sort of trivial, I think, being able to provide that for people, but I think it also really speaks to the quality of life for folks. You know, reading is a real enjoyment for people. If you're a reader, you know that, and to be able to allow people to continue to do that when their eyesight might not be as good as it was before. Library is also I kind of sometimes, as I'm sitting in my office here and I hear our staff at the desk greeting people, it kind of reminds me of Norm from Cheers, where you'll have people come in and we know their names, and sadly, sometimes you just realize that that may be the only human contact that they're having for that day. And so having a big or a nice selection of large print materials for these people, large print books, well, unless you follow the world of publishing, publishers over the last decade primarily, there's been a lot of large publishers buying out the smaller publishers. So the competition for publishing companies just isn't there. So we are kind of at the mercy of paying whatever they want to charge for us. And as you can imagine, it does cost them more to print a large print book. Larger print means more pages, means a bigger binding. So each book costs more. I was looking just to give you an example, because the company that we buy our large print items from, we just had a shipment that came in either on Friday or over the weekend. And so I was looking at just a comparison of what it costs us to purchase a regular print book and then what we pay for a large print book. So with the discount that we receive at the library from the people who provide our books, because of the volume, we're able to get a nice discount for that. So for the same book that's sitting out there ready to get ready to go out on our shelves, we're paying $26.25 for that item in large print. We are paying $6.38 for that same book in regular print. So it is a more substantial portion of what our budget is. And so it's really helpful to supplement that so we can continue to provide a nice variety of items for the people who prefer that large print.
I guess just learning a little bit about this, do they just request books, or do you try to guess what folks would like to read, or how does that work?
A little bit. Sometimes people will request items, and not every book that's published obviously gets published in a large print edition. And so the very popular authors will often have both regular print and large print. And so we kind of try to provide a variety. We also kind of know the companies that we order our large print materials from. There's certain, we can kind of choose what we see is of interest for people. So there's a group of people that like Western themed fiction, and we know that's available in large print. So we have a supply of that coming in periodically, a few books of that for the year. There might be some folks who really Christian fiction, and there's some authors that we know we can get those books available for people and provide just kind of a variety of those items. So a little bit of both.
Very good. Thank you.
Kathleen, this question really has nothing to do with the books, but just out of a point of curiosity, out of your budget under the schedule of activities for the year ending April 30th of 2024, under expenditures, your largest expenditure is for culture and recreation for $753,701. What is culture and recreation at the library?
I think you're probably looking at the City of Dixon budget as a whole. We would not have that amount. I don't have the
Okay,
audit
you're right. City of Dixon. Okay, statement of activities under, but it says under the Dixon Library. I'm just a little confused. What that's under under the library.
Right. We do not have a budget line for culture and recreation. I think that probably speaks more to, I'm really am not certain. I'm wondering if it's like the theater money that they provide to that, maybe the municipal band, that sort of thing. But we do not have funding under that.
Okay.
At the library.
All right. Thanks for that clarification.
Sure.
Well, does anybody have any questions other than? All right, well, thank you very much, Kathleen. Do you have any questions or comments of us at all before?
I don't think so. I will give you a heads up that next year I think we're going to, something new that we're offering for the senior population are, we're calling them buddy bags, but it's designed for caregivers who are working with people with Alzheimer's. And these are based on research that's been done. There might be items in there to help give the caregiver information, also specific types of books or things that puzzles, activities that the caregiver can use to work with folks with Alzheimer's. We just got a grant from our state library to start out with 3 of them to see how that goes. But as we go forward into next year, that might be something we would like to increase as well. So we're constantly trying to think of ways to help that population as well.
Very good. Thank you.
You're welcome.
Sounds,
Hey, Reed, is there an assessment for the library? Is there, is there something we do to, beyond what, what we're doing here?
No, well, I mean, the library is a municipality that can do their own levy, or they
Under
are
the
part of the
municipality.
city's levy, I would say.
Under the city's levy? Okay.
Yeah.
But the county has no levy for the library?
Not specifically.
Thank you.
all right. Well, thank you. Thank you, Kathleen.
You're welcome. Thanks for having me.
Let's see. Moving on, is everybody good if we keep moving along here? All right, Serenity Hospice and Home. Suzanne Ravlin? Oh, and, Rob, I'm not gonna guess.
Jacob.
Jacob? Okay, great.
Tiger.
Hi,
You
Jacob.
can call me Rob. Good morning. Thanks for
Morning.
having us and for doing what you're doing, listening to all of the services in our area. When you hear Serenity Hospice and Home, unfortunately, I think everyone thinks of the end, right? You think of hospice. And one thing that's really important, and as of last Friday, I think more than anything, that as of last Friday, Rock River Hospice and Home announced their closure. And so we are now the only hospice that has an actual home, an inpatient unit. And I think that's really important. One thing people don't realize is that home can be utilized as a place for respite, right? So many of us, and I'm just going to put on the docket, many of the let's call them Midwesterners, they want to be in their home, and I understand that they've lived in their home their whole life. But that idea that there might be a couple of times where their caregiver needs a break, or, they're in a situation where they're changing a medication and it would be nice to have the set of eyes on them for 24 hours, that home is that resource. So it's not a long-term care home, but it is so important and vital. And there's a reason why, unfortunately, there is only one home, because it is so difficult financially. It is not the same as the other hospice services. And, nonprofit services are different than for-profit, make that very clear. And so hospice right now in the news is getting a bad rap. And I think that there's probably the differentiation I always like to say is that for-profit hospices are making about 13 to 14% a year, and nonprofit are losing about 1.9% operationally. So there is a difference. And that's why we're here today, because we're able to provide services. I'm going to brag. We're the only 5-star, which is rated by CMS. It's a survey that goes out that we cannot have any part in. And it comes back based on the services that we provide, the quality of care that we gave. And so we're the only hospice in all of Northern Illinois that has 5 stars. And so we prioritize quality first. And part of that is also just taking care of everyone and our supportive services. So that's kind of what we're here today to talk about, is those supportive services that are not covered by Medicare, but kind of as I alluded to, I would say there's a lot not covered by Medicare, even in that just talking about the patient services. But the other things that we think are so important in our community, I live in Lee County, Jacob lives in Lee County, is we do have an aging population and we want to prepare them. We're all mortal, whether we want to admit it or not. And so what we find is that the more that we can prepare and think about the end of life before we have to, the better that experience can be. And so we provide a lot of services for education. We provide palliative care, which is really important and something that we need to make sure everyone's educated on. And they don't think that if somebody is receiving palliative care at Serenity, that doesn't mean they're dying. Although again, the concept that even I am dying, it's just we all are dying at the end of life. But
Suzanne, can you
Yes.
define, I think it's important to define, Suzanne, to define palliative care.
yes, thanks, Jason. So palliative care services can be a lot of things. That word palliative means supportive care. For us in Serenity, palliative care is that idea that we look at the whole person holistically from a medical and social perspective. And we just found out by the end of the year, we'll be the only palliative nonprofit in the area that goes into the home. But what I like to describe it is we go in the home and ask the person, what's going on with your entire, continuum of care. And so it's a place where you can go and really honestly, so that your other family members or caretakers can go to say, okay, I go to this many appointments, I'm on all of these medications. There's a lot of confusion. I mean, it is confusing when you have to see more than one specialist, or when you think of anyone who has a cancer diagnosis, they're usually only seeing their cancer doctor, and their job is to cure the cancer, not to look at the entire health of the individual, which typically has a lot of other, issues going on. And so our palliative care program goes in. I don't know how you can take care of a person without physically seeing them from a holistic perspective. And so we want to be that resource so that we can, you can call and say, hey, the doctor changed my med, and, I've called and left messages, and we can be the one to answer those questions. And so for us, then we get to know our patients really well. And I say this all the time. We've had patients for 9 years in our palliative care. And the only reason for that is our palliative care program has only existed 9 years. So the idea is we want people at the right time and the right diagnosis as well. So if you know anyone that, has a cancer diagnosis, has dementia in any way at any start of it, or even is seeing multiple specialists, I think palliative care is the way to go, Jason, especially with us. The difference is we don't want to be a, chronic care management for someone who maybe is, early in life and just dealing with, other changes of life. We want to be able to take care of those at the end. And this all comes full circle to really be able to also help those caregivers, because we want people to be able to be with their loved ones rather than being the medical provider, the caretaker, being the one stressed out about the medications and having to Google things and having to, and so if we can be that person, that expert, we really find that can help everyone. We're big proponents of caregivers. You saw that in our proposal. We do a lot of caregiver support groups. There's so much to this psychological and emotional component of being mortal that we know as being the experts, we can be the ones that can talk about this, that can provide the expertise. The other thing we didn't put in here necessarily for the funding, but I think it's important. We're going to be bringing it to Lee County. We're going to be bringing it to everyone. And it was mentioned, and I'm excited, Kathleen, when she talked about the buddy bags for dementia. We're going to do dementia training, and we've invested a lot to have one of our own team members be able to provide that training, but you go through an immersive experience of what it's like to have dementia. And we can provide that for the long-term care employees so they know what their patients are going through, as well as family members. And again, if you read the statistics, and it's great we're living longer, but that also means we're going to have these kind of diagnoses. So again, we're proud to provide all these services. I haven't even taken a breath because there's so many services that we do. I just feel like that's what we're primed for, is taking care of one another in small communities like this. And we're able to do so from the support of grants and donations and people, really taking care of other people, which is what I've seen my whole life and heard most of this morning.
So grants, donations and grants are, when I'm looking at the statements of activities, it's donations and grants are combined together. I mean, are you heavily dependent on grants or donations, or how's that split out?
Yeah, Jason, we kind of took a full reset, if you will, looking at our financials and what makes the most sense so that we can make sure that we are identifying what it takes operationally for us to provide the actual patient care, and then also, what we're going to need in the future. And so as we've been doing that, our financials do look a little different this year as we propose them. Lucky to have a new local CPA in his role, Jacob, that's here with me. And so right now we're not dependent on grants, but we know in order to do, these things that are not covered. And in fact, we just got the update from Medicare reimbursement, what they're going to provide for the next year. And it was down from previous years. So
Now, this is one of the concerns I have for someone like you and for your organization, is that with all of the fraud that's being discussed and uncovered, that there's going to be a sweeping reform in funding for hospice and how that might negatively affect you. And for us to locally figure out if we can look into the future, how this may impact what your services are. I mean, I've experienced hospice. I appreciate very much, but I'm concerned now with what's really going to happen on your, that's why I'm asking the question about how much are you depending on these grants, because there's could be a significant impact, which I'm sure you're aware of.
we are concerned, but I think, what we really need from the community is the understanding that there is a difference in care, right? That's important. And what I mean by that, like you said, with the fraud is just saying to anyone, even if it's nationally, if you have, a family member in Florida, Nebraska, and they don't know about hospice, they need to go and look and see what is that CMS rating. Is it 3-star, 4-star, 5-star? But even in our area, the for-profits have gotten so aggressive. They are selling, the clinicians are going into long-term care. They're going into nursing homes. They're going into people's lives and saying, kind of, I would say, making promises, as well as, skewing what then, the services. It has to be a balance, right, Jason, as you're saying. And so they get to pick and choose their patients. We will take everyone, which I'm very proud to say, but they will say, oh, this patient's going to cost us more money, so we're not going to take that patient. But this patient looks like somebody who's going to be a long time with us. And right now, the way the system works is you are paid on a daily basis, right? And
By
so
Medicare.
By Medicare, yes. And that's, the 90+% of patients in hospice. And so I agree with you. I think that we're trying to prepare for that. Our model is, we're thin already because of the fact that we are the kind of place that if someone calls and they want to visit, we come. Other places might say, oh, your 2-week visit isn't 14-day visit, is in 2 more days. We'll see you then, which helps you on mileage. That helps you on how much you pay your staff, those
So
kind
how
of things.
how far and wide do you serve?
We do. We have, we serve about 9, I want to say 9 counties, but
9.
really our focus is primarily Ogle, Lee, Winnebago, and parts of Whiteside, but we really feel like Whiteside's going to need us. And so, but again, you know, over 20% is in Lee County and over probably 40 to 50% is in Ogle. The reason why we're in 9 is it's very spread. It's because when someone calls us, we try to find a way to make it work, to be perfectly honest. You know, it's not as if we're in those counties, you know, we don't go into long-term care facilities really far away.
Is there a hospice home in Winnebago County?
In all of northern Illinois, there's no,
You're it.
we're it now.
You're it.
I think the closest is Barrington has one, and then Peoria. But
Oh.
other than that now with Rock River Hospice closing, we're the only one. We're also the only one who will do pediatric hospice. Very proud of that, you know, it's a different world. Pediatric goes all the way to age 21. And so, if you think about that, you know, we've had a number of patients through the years, whether it's a newborn and their family needs, because of the diagnosis, they know that their newborn child,
Yeah.
you know. The other one that has one like us a lot is in Joliet, that has a great reputation, and we work with them a lot, but we're definitely becoming the unicorn, that's for sure.
How many people do you employ?
Right around 90. In our census, we have about, today we'd have about, I think we have 90 patients today in our hospice program, and then 86 in our
What's your
palliative.
occupancy in the hospice home in Oregon?
We have 8 beds or 8 rooms. They're not really beds. They are full on kind of apartments, and that's what we want. It is a home, and please, if you're ever on Route 2, pop in. We'll give you a very quick tour, but to see it before you need to see it, you know, is really important. It is. The occupancy, right, it changes daily. We will go from 2 to 6 in 8 hours. But, you know, depending on that length of stay, you know, I can't tell you how many times we hear, I wish I'd called sooner. I wish I'd called sooner. And that's why that palliative program is so important, because we can help you so that you're not saying, I wish I'd called sooner, you know?
Well, and it removes a lot of the stress from the families, doesn't it?
That's, I mean, if I could say one thing right now, they call it the sandwich generation. I think probably every one of us in this room right now, where you're sandwiched between sometimes taking care of parents or friends as well as kids, grandkids. And so the number of appointments, the number of, you know, like I said, medications or questions that you have, it's affecting our workforces. It's affecting people's just daily lives. I think they're, like I said, mental, psychological, you can feel that stress. And so we've seen it over and over. Once we can kind of get that started and that understanding, you know, most of our patients we get, and again, when you ask Jason about the counties, is because it's a referral. My mom was there, my, you know, or my brother was with you. And so they're in Freeport and they really want us, right? You know, Freeport just was their hospital and hospice is bought out by Mercy. They are a for-profit. They don't take, you know, they don't take non-insured patients. So we're concerned about that. But, you know, we try to really focus on what we're good at and the communities that we're good at. And so that's a priority.
All right. Any other questions? Absolutely.
Very much.
Yeah, it's sad. And I promise you, it can be so, it can be very different end of life. It can be really a positive experience, you know, and so, but that's what we want, right? And it can also be so traumatic if it, you know, and there is traumatic death no matter what, but with this being about our senior citizens, you know, please, if you know anyone, just have them, they don't have to sign up, but just have us come into their home. If nothing else, we'll tell them like that's a tripping hazard, right? That's all we would really, you know, love to do.
You have a governing board, I assume?
Mhm.
Okay, and it's made up of people from all over or some from
Oh, definitely all over. And we have two. So we have our association kind of operation board. Former Lee County Board member Tom Demmer is on that with us. Now he just
We're
joined.
not going to hold that against you.
Yeah,
No.
yeah, exactly.
He's a friend. I'm kidding.
I'm going to make sure to highlight that for him. No, and then we have a foundation board, and both boards we make sure is represented with Lee and with our counties that we serve, and that's very important. OSF, we always want to have someone from there. We did our KSB in the past, and trying to make sure we understand that and make sure our board also has all the generations on it, because that's important as well.
Thank you.
Really appreciate your time, you guys.
Thanks
Thank
for
you.
coming today.
Thank you.
I don't see anybody from the Village of Pawpaw or the Village of Ashton. Do we have anybody? Well, for those of you that came out today, I really want to thank you for coming out and what you do, the services you offer for Lee County and for the whole Northern Illinois area is unbelievable. So thank you very much. Probably going back to the minutes from the last financial committee meeting. Everybody have a chance to look at them? And anybody see any reason to?
I make a motion to approve the minutes from the last. Second.
All right. Any discussion? All in favor, say aye.
Aye.
Any opposed? All right. We have no, make sure I'm covering everything here. That concludes all the presentations, so we are not going into executive session for any reason, so we have a motion to adjourn.
Our next meeting is tomorrow, isn't it?
Yeah, tomorrow morning
Tomorrow.
and 9 o'clock. Okay, 9 o'clock
tomorrow morning. Okay.
Move to adjourn.
Move, Mike,
Second.
do we have a second? Jason? Any discussion? All of those in favor say aye.
Aye.
Aye. All right, thank you very much.